you think about, displacement is kind of a form of grieving, actually. I mean, you're losing something. And what we tend to see both in people that have encountered trauma and people who are grieving is any kinds of activity that they can grasp onto to feel a sense of control in their life.
That was Candace Schaefer, Twitter's global head of employee wellness, talking about one of the ways employees can respond to prolonged working from home. What happens to employee mental health when you add a global pandemic to the usual stresses and strains of work and life? In this special episode of Silent Superheroes, I asked this question of two experts in the workplace mental health field and get their advice on helping employees navigate the COVID-19 coronavirus outbreak. During our discussion, we identified the two key impacts of coronavirus on mental health. We discussed how companies should manage the impact of coronavirus on mental health at work, and we also look at the positive impacts we may see as a result of this crisis. My name's James Pratt. I'm the host of Silent Superheroes, and I'm really glad that you're here.
Welcome to the Silent Superheroes podcast, a series of frank conversations about mental health at work.
Welcome to Silent Superheroes. Today is the 11th of March, and we are in the middle of an outbreak of a new disease, which I'm certain you've heard of, called COVID-19 or coronavirus. There have been 118,000 recorded cases worldwide as of today, and 4.2 thousand deaths. And actually, it happens today that the World Health Organization has described this as a pandemic. A number of companies, to help stop the spread of the disease, have decided to send their populations home from work to work at home. I looked at a website called stayinghome.club today, which has 128 companies listed as either working from home or encouraging people to work from home. Includes companies like Adobe, Airbnb, Amazon, Apple, Asana, Atlassian, and that's only the A's. In fact, that's not even all the A's. Companies you'll know like Dell, eBay, Expedia, Facebook, Google, LinkedIn, Microsoft, Pinterest, Salesforce, Spotify, Twitch, Twitter, and Uber have all got some kind of work from home guidelines in place. So as these companies are telling people to work from home, they are wrestling with all sorts of new logistical challenges, like, do people have equipment to work at home? How are we going to communicate? But one of the things that I haven't heard many people speak about yet are the potential impacts to mental health. And so today we're going to discuss how this outbreak and these policies around working from home are affecting employees. And we're going to suggest what companies can do to support their employees through this outbreak. And I said we a few times there. It's not just me. So I have with me Dr. Candace Schaefer, PhD, and Dr. Myra Altman, PhD, which I realize in both cases I was completely reductive and gave you a doctor title and pointed out your PhD.
It's okay. We like it.
We'll take it.
Candace is the global head of employee wellness at Twitter. She's done stints at Facebook and also Department of Veteran Affairs. Her PhD is in counseling psychology from the University of Kansas. So, Candace, welcome to the show.
Thank you. Thank you for having me.
And then I also have Dr. Myra Altman. Myra is the head of clinical care for a tech company called Modern Health. She holds a PhD in clinical psychology from Washington University in St. Louis and was a postdoctoral fellow in healthcare innovation at Stanford. So, Myra, welcome to the show.
Thanks so much for having me. I'm excited.
So, Candace, talk to us a little bit about what you do as the global head of employee wellness at Twitter.
So for me, I oversee all the programs, initiatives, anything related to wellness. And I try to aim it more as a preventative part of health, not just the reactive side. So all employers have medical plans and dental plans, things like that. But for me, I'm looking more at how do I create programs within Twitter that creates a culture of we take care of ourselves and we're proactively taking care of ourselves. Because one of the biggest issues in tech and a lot of other industries is burnout. So a lot of my goals are related to that. And then in addition to that, I also do work related to our employees that work with graphic and sensitive content. So there's a lot out there in terms of we don't know how this can affect people. And so I'm on staff as a psychologist to kind of create preventative programming and training for our employees that work with this type of stuff.
Curious person in me wants to ask about 100 more questions about that because it's a fascinating, part, I think, of social networks and social media. But we don't have time for that today. So Myra, let's turn our attention to you. Why don't you tell us a little bit more about what you do as the head of clinical care and maybe also what is Modern Health?
Yeah, absolutely. So I'll start at the end there with what Modern Health is. So we're a mental health benefits platform. So we work with other companies to provide comprehensive and holistic support for their employees. So similarly to how Candice was mentioning, where there's physical health benefits for employees, how do we treat mental health the same way? So we think about it very holistically on a spectrum from green to red, and everyone falls somewhere on that spectrum of mental health needs. So how do we support them proactively, preventively, but then also from a treatment lens? So my role is VP of Clinical Care. I head up essentially all the types of care that we provide. So I manage our coaching network, our therapist network, as well as the digital content we provide. And then also work really cross-functionally in our organization to make sure everything we're doing makes sense from a clinical standpoint, whether that's working directly with the companies that we work with on helping them set up their benefits, or making sure that the product team is really implementing the best behavioral solutions.
And if I, might speak from my personal experience of Modern Health, as an HR leader, a company I was working at, we chose to adopt Modern Health, and it was probably one of the best received benefits I've ever rolled out, just illustrating the paucity of care that you can get through traditional benefits, and the fact that it gave access to coaches and therapists in an on-demand way was hugely popular. So thank you for everything you're doing.
Yeah, thank you. And I think that mirrors what we're seeing. This is just such a huge need. And I know we'll talk about that as it relates to the situation. But typically when we roll out at an organization, even if they don't think there's sort of mental health needs in their company, as soon as you provide something, just the hands start going up in the air. And this is something that a lot of people need. So we're very grateful to partner with organizations that are taking this so seriously and really prioritizing it.
Let's start by talking about what are the ways that you have seen COVID-19 affect the mental health of employees, as they've gone out to work from home and, just in general.
I would say in response to kind of what I've seen at Twitter, there's been, I think, some legitimate concern. Obviously, we don't know a lot about this virus, so there's a lot of uncertainty. And anytime you have uncertainty, you have anxiety. A lot of our employees, I think, look to our leadership in the company to provide kind of a guidance on how they're supposed to be responding. And given how we respond is how a lot of times they're going to respond. So we want to make sure that our leadership is properly informed and we are going with as factual basis as we can find. But the other thing that's been interesting for me is that one of the first responses when we initiated the work from home policy was our employees that have salaries became concerned about our employees that are hourly and that are contract and really only work inside our physical offices. They immediately were concerned that these people would not have pay. And I was just amazed by that concern, given kind of also what we've been seeing in Costco's and people kind of fighting over very definitive resources, and having that compassion and concern has been good. But
are you adequately stocked up on toilet paper?
This is maybe a little TMI. I got a bidet actually, so I don't have to worry about it. So I'm very
Candice is always setting the bar for the rest of it. It's just something to know from the outset.
Did you have the bidet before this outbreak, or was it like a bit of emergency plumbing?
I live right by Costco's headquarters, and we were still going to the stores and there was nothing there. And so we were just like, you know what? We're going to get a bidet because this is ridiculous. We did that. It's a good investment, I will say. But, in regards to our shift to working from home, the first thing we did kind of see pop up on our Slack channels was the concern around loneliness. And not feeling connected to the people we work with and to just have that sense of community. Some people were really excited, mainly introverts like myself. I was already working from home, but like introverts are usually more excited to do that work from home. And for other employees, it's a bit challenging because they have to maybe work in a smaller home, or they don't have anybody to talk to during the day, or there's no reason to go outside. So there's kind of a lot of challenges that maybe we haven't thought about before, that it's kind of forcing you into this new situation and problem solve, which I've been really excited to see how Twitter's been doing with that.
And Myra, anything you want to add based on, both either Modern Health sort of direct experience or any of the customers that you're working with?
Yeah, we'll say a lot of what we're seeing is really mirroring what Candice is saying. So definitely an increase in anxiety. Back when I was doing more direct clinical care, like uncertainty and lack of tolerance of uncertainty is just such a huge thing for people. And so when there is no certainty on this global scale, I think we're really seeing that exacerbating anxiety for individuals, but also then the more that we're uncertain, it causes more anxiety. So I think there's like the concerns about coronavirus, and then there's the reaction to coronavirus, and both are causing their own different types of anxiety. I think social isolation, loneliness, particularly in places where they, we saw this in China initially when there was quarantines in place where people really are forced to stay home, and seeing that isolation really skyrocket. But then just from work from home, and about half of my company is remote at this point. And so we're starting to see this for us as well. Unlike Candice, I am very much on the extroverted side of things, and I'm working from home, which is certainly challenging. I have my puppy, which is helping, but I think it's kind of an unprecedented time in our way of working, and it'll be really interesting to see how it evolves and what that changes just in the way we work generally.
What are some of the things that you think are causing that anxiety?
So I think there's a few things. There's the anxiety around the illness itself. Could I be contracting this? What would it mean if I did? What would it mean if my loved ones did? But then I think we're seeing that's kind of on the individual level. Then there's the societal impact too. What impact is this going to have on how the world functions, right? We're seeing the stock market. There's a lot of volatility. Are we going to go into a recession? What does that mean for my retirement savings? What does that mean for our ability to bounce back? And then to some of the more social pieces, like seeing a lot of discrimination come up in response to things like the coronavirus. What does it mean as a society for people who look like me or for people who don't look like me? So I think there's these multiple levels all causing anxiety for different people or in different degrees.
We're kind of handling the dependent care, child care situation too, as schools are beginning to close. To prevent spread of the outbreak. There's a lot of dependencies that happen within our own economy that are kind of disappearing. And so it's really challenging, I think, a lot of the way people live their day-to-day life. A lot of the things that we took for granted or we just kind of assume is there, it's not there anymore. And so it feels like the earth underneath you is coming apart.
Even probably being 2 generations out from the Second World War, I always had this sense and a feeling of the harm and the sort of danger and the struggle of living in a place where you were constantly under threat. My dad was born in the, in the time of the Blitz, for example. He never had to experience it kind of as a, child, but certainly he was there. And it occurs to me that that's not happened in the US for a very, very long time, like an existential threat. It feels like almost the impact is worse because there's no real frame of reference for what it's like to be a society under threat.
Yeah, I think this kind of, it in many ways, I think feels similar to 9/11 when, things shut down. We didn't know how to kind of handle that situation. Yeah. Well, it's so long ago now. It's over 20 years ago. And so just to think about how life stopped back then until we got our grounding again. And it feels very similar. If
I might add something, I think what's so interesting too is when I think about uncertainty, it is so hard for us to tolerate as humans, and yet we tolerate a ton of uncertainty day to day. And so as we're thinking about these existential threats, I think something like coronavirus, it forces it to be front and center because it's actually impacting our day to day. But if we think about kind of just the zeitgeist of the moment over the last several years, right? There's climate change, there's nuclear war tensions, there's all these things that I think have also been accumulating for people. Like there's been this expectation that something's going to happen, something big is going to happen, and now this might be that thing. And so it's how do we then respond to it, and how do we react to it when we're forced to confront it? Whereas I think usually we can go about our day to day because it doesn't impact it as much.
If we think forward a second to this crisis continuing to develop, what sort of other impacts might we start seeing kind of as time goes on?
I know for me, just kind of thinking about it, especially, my interest being in preventing burnout, is if we have people working from home long term, I think we're more vigilant when we first start working from home for the first time. We're aware to kind of keep those boundaries with work and with your personal life. But as time tends to go on and stress increases, and that can become a little less cognizant for a lot of people. And so I think there's, potentially a risk for work-life balance lines to blur a little bit more if we don't kind of stay cognizant in front of it. And then, I also think there's that sense of uncertainty that we were talking about. A lot of scientists have said, we're not going to have a vaccine until next year at the earliest, and we don't know how long this is going to go on. And so to kind of prolong when we will get back to normalcy, or will this become the new normal, is really challenging from a cognitive perspective.
And that feels like more of the anxiety.
Yeah, and I think it's going to depend so much on what direction this goes, right? Is it going to be a month, 2 months, and then it follows like a flu sequence where as the winter in Northern Hemisphere wraps up, this goes away? That's going to be very different from if it continues to get worse and there's further quarantines or more work from home. I also do want to throw in the piece about human resilience as well. Like there's tons of research on we bounce back and we adjust really quickly. So I wouldn't be surprised too if people also start to adjust to kind of a new normal. I think Candace is totally right though, that how do we really stay mindful of the best practices that we're starting to see people put in place to manage mental health and isolation and burnout, and don't kind of let that fall by the wayside as we adjust to what might be a new normal, at least in the short to medium term.
Well, it feels like you posed the question, so good time to answer it now. So how do you do that? How do you maintain that mindfulness that you may have now about your work-life balance and working from home? How do you maintain that over time?
I think it's a kind of, it's an individual coping strategy, but really there's a lot of different ways to do it. Like I know for me, having a partner at home that is constantly aware of when I'm working after hours and then kind of badgering me about, we're going to go watch that episode of Narcos. And you're taking up time off the clock, having
something just to relax, not stressful.
Yeah. I go to an escape world where
I'm all Great British Baking Show. Only the Great British Baking Show in times of stress.
Reality shows are good too, but yeah, just it's having those prompts around, and I've even seen suggestions to. If you don't have a dog or a cat, to consider fostering one, because they get you outside of the house. They make sure you get up every day. Like when we live inside our home for long periods of time, like I think back to even summer break as a kid, like you don't even know what day it is. You don't know what day of the week it is. Like it can get kind of blurry. So having a regular routine and schedule is a really important part of kind of sticking to that.
And I feel like I can definitely speak to that. So, I think Myra knows this, Candace, you wouldn't because we've just met, but I'm bipolar. And so routine is really, really hard for me to establish. And I now have started working from home in the last few months. So I've had to make a special effort to go outside because I could so easily end up staying in here. And I feel it. Like if I do 2 days straight inside, I start to feel my kind of sanity start to fray a little bit. And I'm like, oh, I need to go outside. I need to look at the sky. Do you know what I mean?
Yes. Even like showering, things like that. I think when we work from home, we're like, oh, nobody's around, or I can just turn my camera off and no one will see how, how maybe unclean I am. But
are you going to put on real pants today? Are you going to stay in your pajamas? Not sure.
They kind of look formal. I don't know, so those basic kind of self-care things, or even just putting on like normal clothes. I've had some talks with my own partner about that, and he's like, "Why? You don't need to." And I'm like, "I know, but there's a mindset that goes along with wearing clothes that you would normally wear in the outside world, and it's also, if you were to go outside, you're already set to go. It's not an additional barrier where it's like, okay, great, now I got to get dressed and look presentable."
I've personally found that kind of going out and working in a coffee shop is great because you're around other people and kind of part of the world. And so that helps me not isolate when I work from home.
Well, two pieces. One is that line between work and life is blurring so much already. Even the concept of work-life balance, I think, is sort of outdated because it is also integrated. And now this work from home adds a whole nother layer to that. So how do we get even more conscious of that? So we have some folks on my team that were saying, like, I'm going to set alarms for when I'm done for the day because I don't have these external signals, for example. And I think we so often rely on, at least in the US, like on individuals' sort of willpower to do these things and put these practices in place. So as much as possible as we can make it just the routine and the structure, whether that's having outside people like your partner, Candace, or a teammate saying like, "Hey, have you taken a break today?" Or "Have you done something else?" Or "This alarm is going to go off to remind me to eat lunch or to take a break." Like those things I think are more important now than ever, and not just relying on our own kind of willpower to remember or choose something wisely in the moment.
I'm thinking about all the, we talked about kind of the anxiety that people are experiencing, the loneliness, the sort of concerns about social justice as well, which was great to hear, by the way, Candace. Are there kind of specific, tangible kind of examples that you can speak to of things that people have been experiencing there?
My team here in HR has been working like very hard to be proactive and not just putting a one-way communication out there, but having Slack channels internally that we can engage in a conversation. So we have, like, since our work from home policy has been started, the amount of Slack channels that have been created has just skyrocketed. We have people that are participating in groups that are not related to work at all. Like some people just post recipes or what they ate for dinner that night, or our dog's Slack channel is incredibly popular because it's just a nice break from the day. So if anything, having us as HR professionals out on these channels and being aware of what kinds of things are on the minds of our employees is the best way to kind of stay in front of it and be in tune with it. And it's really, really worked to our advantage.
I love that because it also speaks to the human need for community. Like, it's almost like now that we can't necessarily interact in person, we're realizing how much we need that. And so finding these sort of new ways of interacting, whether that's, we have a lot of Slack channels as well that have become very popular, or people having these sort of like WhatsApp group conversations that they might not have been having, or more FaceTiming, or I know Zoom's stock, for example, is through the roof. It's like the only one, right? I think it's really highlighting our need for lots of connection and collaboration, which is hopefully something that will kind of persist even once this is done.
As you're talking, something occurred to me, and it's maybe not a well-formed question, but the word displacement came into my head. And people have, a place that they're used to going every day. Many people do, and they are suddenly displaced. And there are other people kind of across the world, other situations where people deal with, displacement, in an extreme example, perhaps as a refugee. And I was wondering, are there any things that we would typically see when someone feels displaced from a mental health perspective?
And Candace, I'd love your thoughts on this too. What we typically see when someone goes through any type of big stressor or trauma, whether that is kind of on a personal level or on a societal level, is that we're going to expect as mental health professionals to see an escalation of mental health symptoms. Like people will have stress, anxiety. Sometimes people will have nightmares, flashbacks, kind of all the things that we typically associate with PTSD, post-traumatic stress disorder. Like that's fairly common in terms of psychological responses to high stress. What's also common is that it goes down over time because we're resilient, we adjust, we cope, we adapt. And then obviously for some folks, it's going to stay high, and that's where kind of PTSD treatment is really warranted. So I think we're even starting to see some of those same things with really high anxiety, fear reactions, startle responses. People are scared to go out of their houses, right? They're avoiding places. Like that's all really common reactions to trauma, to high stress situations.
Yeah, I would agree. And if you think about, displacement is kind of a form of grieving, actually. I mean, you're losing something. And what we tend to see both in people that have encountered trauma and people who are grieving is kind of any kinds of activity that they can grasp onto to feel a sense of control in their life. This is how, in an extreme end or an extreme case, we might see someone with like obsessive compulsive disorder who's performing rituals in order to calm themselves. And you can sometimes see that with, people once they're adjusting to something like displacement, where they may have rituals, they may have a routine, they may have something that gives them that sense of I'm feeling grounded and I feel safe, even though it may or may not be actually giving that.
Maybe back to your point, James, of like, what are we seeing? One thing that almost fits that description to me is people's almost obsessive checking of news and social media to get as much information as possible, which we see, it really resonates. I've done a lot of work in OCD or other anxiety disorders. People want that certainty. They want those answers. So like checking news sites multiple times a day, checking social media sites multiple times a day, and not always the most reputable sources. And I think people are searching for that certainty and that anxiety reduction. And actually what's happening is their anxiety is skyrocketing as they do more of that. So I've certainly had a lot of folks I'm talking to about how do you put restrictions around that? How do you pick your one or two places that you know are reputable and you check them once or twice a day and no more? Otherwise, it becomes this kind of overwhelming compulsive checking.
So you gave some great examples there of somebody with OCD maybe getting more into a sort of obsessive routine. So if I'm an HR professional or a manager or a leader, what kind of things should I be looking for in employee behavior that tells me like, hey, maybe that person needs, some additional support, attention, whatever it might be?
So what we typically think about for the mental health side is like, if you're evaluating if someone's behavior is responsive or adaptive, is it in line with what most people are doing, right? So with OCD contamination and people are washing their hands every 10 minutes, it's pretty clear that that's out of line with what most people are doing, even if there's a lot of variation within that. I think what becomes tricky in situations like this, where everybody's behavior is shifting and that like the spread of behavior is very different. So more people are engaging in more hand washing, and just to use that as an example, but to look at, again, that extreme, is it really more than what kind of the average person is engaging in, or significantly more than what the recommendations are? And is there a lot of distress associated with it? Because there's a big difference between I'm going to wash my hands now much more often than I did before, but I'm not necessarily going to be really panicked or distressed around it. It's like, what's the functional response?
Yeah, I'll add to that too. A lot of what we look for as clinical psychologists is what we call an impairment in functioning. So this could mean like you're not able to work, or you're significantly impaired in your work because you're too busy washing your hands, that you can't get work done. So you might look at someone's productivity, and if you see significant declines, or just kind of general inability to focus, those could be some potential indicators.
So I think if I were to sum those up as a manager or an HR leader, I'm looking for how far outside kind of the current norm is someone's behavior. We might all be panicking a little bit, but if someone's kind of running around screaming, they're panicking a lot more than other people. That was obviously a silly example, but hopefully just to illustrate the extreme or potential extreme. Or looking for where maybe somebody's performance drops significantly, than the norm. And I think in both cases, what I'm hearing is like, think about where they usually are, think about where everybody currently is, and look for people who are, kind of way outside the norm there. And those are the ones that might need help.
And I think one of the hard things for HR too is people might still be functioning well at work, and that might disguise functioning difficulties in other areas. So given the priority that people give to work, it's like all their energy goes into kind of maintaining functioning in that one area, and other parts of their life might start to slip. And so as much as possible, how do you open up that conversation to get a sense of how is someone doing generally as well? Like, how's their family coping? If they're a parent, how are their kids? How are they managing that? Like opening up those conversations so that you get a better glimpse into the full person.
Yeah. So talking to people, right?
I know.
Basically,
wild suggestion.
It's one of those things though that just in my experience working in multiple companies, it's a very terrifying conversation to have if you're not mental health professional, and even for some mental health professionals it can be a little terrifying. So to ask about someone's mental health, I know there are a lot of people that worry about the legal risks around that. So like a lot of being cognizant. You want to be caring, you want to check in, you want to be empathetic. But at the same time, how do I respect someone's privacy if, they're going through something and they don't need my, help as a manager or trying to work through this?
To me, I feel like, you don't have to ask about somebody's mental health. You could simply show human care about how somebody's doing, and acknowledge that, hey, this is a really stressful time for everybody. So much is changing. I just want to check in with you and just hear like, what's your experience of going through these changes right now? Like, what are you noticing that's like different for you in the way that you behave? And just, show care, open up a conversation, and then see what comes of it. And ultimately, if somebody shuts you down, it's like, no, everything's absolutely fine. Like, I'm doing great. While in reality, their life is falling apart. That's not on you as a manager. Like, you're reaching out to do the right thing. Somebody has to step into that.
Yeah, and I think there's a lot of research out there too about managers being vulnerable with their own teams. The most important thing that I've taken just from my work at tech companies in the past few years is that manager is a very, very important part of someone being in the company long term, because they set the tone and they also help set the cultural expectations around working from home or productivity or how we feel about mental health days.
I think Google's Project Oxygen, big part of that, which was trying to prove that managers didn't matter. So they didn't need all these layers of unnecessary managers. And, lots of quantitative, qualitative data, a whole bunch of very smart, quants, data scientists and the like. And they found kind of basically the big conclusion was managers matter. And retention was one of the big things. I would say if you are a manager who knows that you should connect kind of on a human level with people, but has found that kind of difficult in the past, maybe this is a door that opens for you, because it's an unusual situation where manager reaching out and just starting a conversation about how somebody's doing kind of should feel like a sane, normal thing to do. It's not like it's not unusual, like a good human being would do that. So maybe this is the door that you can walk through to connect more with your employees.
And I think not underestimating the power of planting that seed or just letting people know the door is open. Not everyone will run through it and open up, but just knowing that you brought it up and that you're open to it, I think that can be a game changer for so many people. Even if that's all it is, just, hey, I want to know how you're doing. My door is always open. That can be huge for people.
While we're talking about people who are, maybe having a hard time, I put a post on LinkedIn yesterday, or maybe a day and a half ago. And it was like, hey, don't forget to thank your HR person right now, because they're going through a lot. And it was one of those posts where it just kind of blew up, in terms of the number of people who liked it and, number of people who ended up seeing it. So what should we all be thinking about in terms of supporting our HR teams going through this?
That's a really good question. I can't agree more with the expression of gratitude. In HR, we do a very thankless job. And not only that, we're usually the not fun. I say this to my boss all the time. We have the not fun job because we have to say no a lot of times. And we don't want to say no, but a lot of times we have to. And so to express appreciation and recognition for what these HR teams are doing across the world to accommodate people and to make sure they're safe, in my eyes, is more than enough and would be a very, very welcomed.
Nice. So if you're a manager or leader out there, dropping by your HR team and, finding a sincere way to say thank you.
And I will echo that. I mean, we at Modern Health are very fortunate to work with a lot of companies globally, and just the response from the HR professionals that we work with has been astounding, just above and beyond even kind of what they're required to do in terms of response. It's just the genuine amount of caring that they have for their employees, I think, is just astounding. So I will echo the gratitude. And also, I think for helping professions in general, which I think a lot of HR folks, mental health folks are. There's a lot of caring outward. And so making sure too that people are HR professionals, mental health professionals, healthcare workers that are kind of on the front line of coronavirus are also taking care of themselves, and what can we do to support them, whether that's sort of checking in on how they're doing as people as well, maybe setting up systems where they can take care of themselves, breaks, I don't know, giving people gift cards or something that sort of promotes taking care of themselves as well.
So then I'll take this opportunity, Myra, to say thank you for the work you are doing to build a network of coaches and therapists that people can lean on as they go through this very difficult time to help them get the support that they need. So I'd like to recognize you for that.
Thank you. I wasn't angling for a thanks
I
for
know
myself,
you weren't.
but I do appreciate it.
I know that may have been horrible for you. And Candice, I'd like to thank you for the work you're doing to build programs within Twitter to support people's wellness, particularly their mental wellness, as they go through, this difficult time, and that allowing there to be a platform on which a lot of information about this illness is flowing, and a lot of connection is happening. So thank you. We've talked about lots of the sort of challenges that are facing people. We've talked about some of the things that are happening that kind of are helping people with their mental health, like the Dog Channel as an example. If I'm sort of an HR person, maybe listening to this, what kind of programmatic, systematic solutions should I think about putting in place? Like, what are you seeing is working?
We've kind of diversified a lot of our plans, and they are constantly in flux too. That's the thing. So Twitter works with Modern Health, and they've already gotten plenty of phone calls from me saying, "We need this. Oh wait, no, we don't need that anymore. We need this. We need." And so they've been very, very patient and understanding with whatever our request is at that moment, but. To have the ability to offer support to your employee in whatever forum or medium that might take place. And that's one of the reasons we do use Modern Health, is because the coaching aspect, the counseling aspect, it works on that continuum of meeting people where they are. And then we also think about, within our company of how people are taking care of their children, or do they have appropriate office equipment in their home so that they're not developing back injuries and things like that from working at their couch all day. So it's one of those things where when you think about your employee, you have to think about kind of like everything they interact with and what has changed in their life on that day-to-day basis, and how you can support it. We probably can't fix everything, but we can definitely support our employees in helping them maintain some kind of sense of normalcy.
So I think one of the things I heard there was helping them with the logistics, like reducing the anxiety of, sitting on the couch for 2 months, or, not having the right equipment to do things. And I've seen other companies, give stipends for, internet, or being able to go out and work in a coffee shop and things like that. And so all those things that are kind of logistical needs, to reduce the anxiety that may come with them.
It's been actually a really good thing for Twitter, actually, because one of our goals this year is actually to decentralize, to have more people work online. So this kind of just forced a lot of our goals to happen a lot quicker. And we just had a company-wide meeting either last week or the week before Jack held, and it was completely online. And it was probably one of the best company-wide meetings we've had, because everyone was able to participate. It wasn't just feeling like it was San Francisco based, and people in San Francisco can ask the question.
So Myra, on your side, apart, of course, from adopting Modern Health, what should people be doing?
So I think a lot of what we've been talking to the HR leaders we work with is around social isolation and loneliness, and how to keep people connected to their teams. So we've seen a lot of really interesting strategies come up. So, and one thing we've actually implemented at our office as well is having each team have just a standing daily Zoom meeting where they can call in, but also making it open to other teams. So you can almost still get that water cooler effect where you can just kind of pop in and get some face-to-face time. A lot of teams are even just having that on for several hours and people can just pop in and out. And it's almost like you're working next to each other. So you can ask a question for those social connected pieces. So I think a lot of those types of social support measures, we have now, like my team has like an open doors office hours, essentially, where if anyone's feeling stressed, they can come in, we can practice mindfulness or listen to a song, whatever it might be. But I think we have to start to be a lot more intentional about those spontaneous meetings that might have just taken place. Like I'm even noticing for myself that my core team and the people I work with closely, it doesn't feel like we've missed a beat, even though half of us are remote. But for folks that I'm just used to seeing in the hallway, I don't necessarily know how they're doing or kind of see them day to day. So kind of just popping in, being more intentional about checking in with people.
So what I heard you say is that we need to systematically create more spontaneous meetings.
Right. If that's not super honest,
so weird to say because it's one of the things that feels impossible. But I think this is also kind of forcing companies like Slack, like Zoom, like Workplace, whatever that might be, to have those buttons on there to create more of that spontaneous reaction. So like my manager, if she knows I'm not in a meeting, she just calls the phone button or pushes the phone button next to my name on Slack and calls me right then. Another reason that you should not be in your pajamas all the time is if your manager wants to talk to you right now.
I love those ideas, both kind of addressing those logistical concerns as well as finding ways to connect people more. Because I think in many ways, both pay dividends, not just now, but in the future as well. A more connected team, I think, will always outperform a team that doesn't have those strong social bonds.
Yeah, and there's actually, I think, a study that came out of Google as well. They looked at their remote teams and what made them efficient. And the most efficient ones, the ones that were the most productive, had that communication really strong. And they had, team working norms of this is how we work. And that's one thing that we've suggested to our own teams internally is to think about what are your own team cultural working norms? Like for Myra, they have a Zoom meeting at least once a day. That's an important part of them to stay connected and on the same page. So are there other team working norms? Like if you're away from your desk, do you tell your team or do you change your status on Slack or, whatever that might be so that we're all on the same page and we're communicating the same way?
I joked about the systematic spontaneous meetings, but like another way to think about it is you need to start to build those into your culture. And by culture, I mean the things that you just automatically do. And when you're starting something new in a culture, it is a little bit forced. It is a little bit planned. But if it's valuable and kind of well done, eventually it does become part of the culture and it becomes automatic. And they truly are spontaneous meetings at that point.
I'm really keep jumping to this idea of desirable difficulties. And so desirable difficulties is a concept from cognitive psychology where like if you have to write notes by hand instead of typing them, it's a little bit harder. You have to think a little bit more. You actually remember better. And that's what's kind of coming up for me is that there are these challenges that we're faced. Like teams are not easily connected to each other so that we have to actually try a little bit harder. We have to put some norms in place. And I think that's going to your point, pay off as we prioritize that connectedness because we have to now when we could have just taken it for granted before.
Are there any other things that you think businesses, leaders, HR people, managers, etc., could or should be doing at this time?
I would say, one thing I look to is if we have, a group of champions within the company, whether that's your company ambassadors or your wellness champions. I have a group of resiliency champions. So these are employees that are particularly passionate about a particular issue and whether that's wellness or another, or the culture itself that's being carried throughout your company, to try and see if you can use them to get feedback on how things are going, like have them serve as a focus group for you. And use that feedback to help you implement new programs. And then they can also help encourage people to use them. I think the biggest challenge in, like we were saying, incorporating any new change, new behavioral change into a culture is to make it more accepted and just keep trying it. And so when you have people that are cultural ambassadors within the company, they can kind of help encourage that behavior when maybe if there weren't more people doing it, it'd be a little more challenging.
I'd add as well, given how much uncertainty there is and how much things are changing, what we've seen be really impactful is just early and often and open communication. How can you share as much as you know, as much as is going to change as early as possible, so people have at least some sense of, do I know for now that work from home is indefinite? Do we have a potential end in sight? How is management thinking about this? How is leadership thinking about this? I think fear exists in the dark, and as much light as we can shed on it, I think the better. And I think this kind of harkens back to what Candace was saying before, particularly for kind of groups that maybe are more at risk. So we've been talking a lot about folks who have the freedom and the luxury to work from home. That's not the case for a lot of different types of jobs or a lot of different types of employees. So how can you provide as much kind of context and support and reassurance to those groups as possible, as much as you're able to do within the confines of kind of your business requirements?
We have mentioned a few times that there's positive change in terms of companies, employees, that is going to come through this event. What are some of the things that are top of mind for you in terms of those positive changes?
I know for us, we already had kind of a group of remote employees that we're definitely in the minority. We don't have a lot of remote employees, but we still do have some. And the sentiment a lot of the time was that people who work in offices don't necessarily understand the remote experience. Or if you're having a meeting in an office, they don't think about, what way the camera is angled or how close in is it so that I can see your face and see your nonverbal communication. And so to have that kind of as an empathy building experience for people who do not have the ability to go into an office or work remotely most of the time, I think has been a really strong experience. And I know for me, I actually ended up doing a pilot in the fall with my own team where we worked from home as an empathy building experience. And I loved it so much that I ended up just sticking remote. It's one of those things I think we were afraid of, or a lot of people are afraid of going fully remote because we don't know if we have the self-discipline, or we're afraid we'll get lazy, or people will perceive us as lazy. So to have that experience of just trying it, and maybe this is for you and maybe it isn't. But if it is, that could be life-changing. It could prevent burnout. It can give you more productivity. A lot of studies show that productivity actually increases when you work from home. But at the same point, it can also just show you that, hey, maybe this isn't for me. And here's the reasons why. But I at least understand my coworkers now when they're getting frustrated in terms of our communication, or what is it that they need from me that would be helpful.
I think two big areas jump out for me. The first is we know that anxiety, burnout, stress has been reaching just these incredibly high levels before this started. So I think if one positive thing that can come away from this is we can't ignore it anymore. I think stress is so noticeable and tangible in society right now that we're sort of forced to look at it. And ideally, we then as a society start to destigmatize it, start to think about it, talk about it more, and start to create more change around it, whether it's getting easier access to therapy, more resilience tools, et cetera. So I think that's one change that I'm hopeful will come out of this. And then the other piece is kind of another theme that we've been talking about. Humans need connection. And we, I think, have been increasingly feeling isolated from each other. And again, this just highlights it and highlights our need for the opposite. And so I'm hopeful that kind of as a society, we prioritize connecting with other people, whether that's in person or in these new remote ways that we're trying out. I think it's so interesting to think about if this had happened 5 years ago even, or 2 years ago, and we didn't have all these tools, like this would be a very, very different situation. So we're very fortunate to have these technologies that allow us to connect. And so how do we use them to connect with each other?
So worldwide disaster at the right time is what you're saying.
I don't know if I choose those words, but that's a good, well said. I don't know that there's any good time, but I'll play the optimist today.
Yeah, it has to happen at some point. May as well be now, right? As we come towards wrapping up here, I want to give you each the opportunity to deliver one message to to HR, to managers, to a leader, something that you want them to take away from this and maybe take action on. So I'll let you choose who's going to go first, but I'd love to hear what that message is.
I think for me, it's that we're all human at the end of the day. And I think this type of event kind of really brings that home. And so how do we remember that in every interaction we have with people? How do we treat people as humans, try to understand their needs, see their needs, whether that means just reaching out and asking how someone's doing or thinking more systemically, what are the practices and the systems and the policies to put in place to allow people to do their best work and be their best selves?
I'd say, to the HR professionals, you are doing the best you can with the time and resources that you have available to you.
Damn right.
And I can't emphasize that enough. Like we, during times like this, we are getting asked for the world, and we want to deliver. Most of us, I would think, are people pleasing, and we're helpers. But you have to be able to recognize what your limitation is, and it's probably not, within your control. So just do the best you can. The same thing to managers too, that are just kind of helping their employees through this time. I mean, just do the best that you can and be a real person. Not that people aren't being a real person, but be vulnerable. Share what's going on, in your life and how you're dealing with this, and be the example to your team that you would like them to be. So yeah, that's what advice I would give.
Well, I want to take, Candice, what you said and echo to the HR professionals in my life. You all know who you are. I agree with Candice that you are doing the best job you can right now. You are all good enough, and you're all stars in my book. Candice, Myra, I want to say thank you for your time today. And please keep doing the amazing work that you're doing to support the communities you're supporting right now.
Thank you so much. And thanks for this podcast on bringing these issues to light, because it's not talked about enough. It's not,
and thank you.
Thanks so much, James. Really appreciate it.
Take care, Myra. Thanks. I hope you found this episode of Silent Superheroes useful. As of March 2020, COVID-19 feels like a big deal to a lot of people around the globe. Colleagues where you work may be experiencing anxiety in a number of ways. Personal concern about them or their loved ones getting sick, changes in social norms around work, public events, schooling, and broader concerns about stability and impact on society, for example, the economy. Anxiety isn't the only impact to mental health that we're seeing coming out of coronavirus. If you and your colleagues have defaulted to working from home for the first time, they may be experiencing social isolation because they aren't seeing people every day. Candice and Myra shared some really great examples for mitigating some of these effects. And don't forget, there are a lot of upsides to come out of this situation. I can't tell you how hard it has been for me to get people who work in an office to understand what it's like to be remote. This incident's going to help build that empathy for a lot of people. Likewise, as Myra points out, we are a resilient species, and we'll come out of this better able to weather a storm like this in the future. And lastly, maybe people will learn the importance of connecting human to human as a result of being forced apart for a period of time. Because as sophisticated as our society is, we're still a tribal species, and we still need to feel wanted and valued by others. If you enjoyed what you heard in today's episode, please leave us a rating or a review on iTunes or wherever it is that you get your podcast. If you'd like to hear about new episodes as they're released, you can either go to silentsuperheroes.com and sign up for our newsletter, or you can follow us on Facebook at facebook.com/silentsuperheroes.
Take your mental health seriously. If you need to speak to someone, you can call 1-800-273-8255 or text crisistextline.org at 741-741. Both provide 24/7 confidential counseling to people in the United States. Worldwide, visit iasp.info/resources/crisis_centers/. To help others find the Silent Superheroes podcast, please leave a review on iTunes or your favorite podcasting service.